I've been in the northwest of England talking about Labour's healthcare plan, and I've had lots of questions from you. So many parents worry about the health of their children, and it's not surprising because the sort of sticking plaster politics of this government has meant that children are the biggest casualty. And frankly, if a parent dealt with a child in the way that this government had, they'd be charged with neglect. And we've got to turn that around. And that's why we've launched our Child Healthcare Action Plan, which is the practical things that we can do to improve physical health, particularly waiting lists for children, which are far too high, but also mental health, which is a real concern for so many parents, with many more mental health staff, particularly in schools and across our communities. The state of dentistry under this government is appalling. You've got waiting lists for people who need urgent dental care on the NHS, or you've got, as in West Cumbria, areas which are essentially a desert for NHS dentists. So we've got a plan to turn that around using non-dom money. We'll get rid of the non-dom tax status. That's the super rich who don't pay their money in this country. I think they should use that money for 700,000 dentistry appointments, urgent appointments, make a massive difference, particularly for children and young people, but also an incentive scheme for newly qualified dentists to work in, locate in, and work from some of those areas that desperately need an NHS dentist. So this can be turned around, but it needs a plan, a strategy, and a government with the determination to do so. Mental health is so often the sort of poor relation when it comes to health and care. And particularly with young people, this is becoming really, really impactful. I know many parents worry about this. So to turn this around, we want to recruit 8,500 new mental health professionals to ensure that we've got the people in place to bring the waiting list down, to give the care that so many people desperately need. I think for young people, we need to do even more than that, and that is to have mental health support in every school, so that it's there for all the children that are impacted by mental health, but also to have mental health community hubs in the community, particularly for those who are under 25. Those working in the NHS are under huge strain. I know this firsthand because my wife works in the NHS. They've been through a huge amount with the pandemic, with the waiting lists, and the pressure bearing down on them. Amongst the problems is the fact that we simply don't have enough staff, which is why we've got a workforce plan, which is to ensure that, I don't know if you like, cavalry is coming for those on the front line in the NHS, the backup that they need to alleviate the pressure. We've got concrete plans to turn the NHS around. And by that, I don't just mean get the NHS back up on its feet, that's desperately needed, but also to make sure that the NHS is fit for the future. And those plans include bringing down the waiting list, dealing with mental health, a plan to deal with the terrible situation in relation to our dentistry, and much more than that. Each of these plans is fully costed. We've set out how we're going to fund it. In the end, it comes down to political choices. So, for example, the political choice an incoming Labour government would make is to get those NHS waiting lists down, 2 million a year if we get this right. In order to get that done, we'll abolish the non-dom tax status where the super rich don't pay their tax in this country. That's a political choice. The Labour government will make that choice. This Tory government won't make that choice. In fact, it's made the opposite choice, which is to keep that tax status, and we've got terrible waiting lists. This is about political choices, determination, a plan and a strategy, and working with the NHS so that we can make it fit for the future.